Welcome to another edition of Down the Road. We're going to visit with some folks about the violence in downtown Minneapolis. We're going to get a chance to visit with them. We're going to talk to some folks about cryptocurrency. What's going on in South Dakota? Are people hiding money there? I don't know. We'll visit with some folks about that as well. But we're going to begin with what is a problem. Well, it's a problem where you live. It really is. It's a problem for all of us, and that's the shortage of staff in long-term care. I've had an opportunity to know Shelly Peterson for a long time. She's the president of the North Dakota Long-Term Care Association, and let's bring her in, get a chance to visit with her. Shelly, good to have you coming down the road with us.
Thank you. It's my pleasure to be here today.
You know, there are certain industries that you look at and you say, okay, you know, they're short workers, and there's a lot of that right now. But when it comes to long-term care, that's one that you never want to be short workers at because it affects all of us. And so describe to us, Shelly, just what's going on.
Well, at this point in time, we have 216 long-term care facilities. In data that we shared probably just 10 years ago and even more recently, we had 16,000 people working in long-term care, full and part-time individuals, providing a lot of care to North Dakotans. As I look at the numbers now, and they're measured based on vaccination data, because we have to track everyone that's vaccinated, the health department shows now, based on facility reporting of staff, we have 12,720 individuals. And I know a few years ago, as I was preparing for the legislative session then, we were estimating 14,000. So we're down people, we're down individuals.
So, you know, I made reference, I mean, that's a lot. That's almost 4,000 employees that you could use tomorrow. But you know, I made reference to how this affects all of us. You know, my mother was in St. Francis in Breckenridge, and I realize that isn't North Dakota, but that's where she spent her final days. St. Gerard's in my hometown of Hankinson, you know, it is vital to our community. I mean, it is huge part of our community. Can you see a scenario where because of lack of employees, places like that actually could close down?
Yes, we actually had Crosby, North Dakota close their nursing facility on September 1. Where I'm seeing a lot of negative impact, we have a few in urban settings that are really struggling, but rural North Dakota in general, rural long-term care facilities are struggling. We've had to not admit, and we've had to set up special COVID units, so we didn't have the capacity. But we have, when we tracked our revenue based on cost reports that were just submitted to DHS on September 30th, and our revenue is down $62 million in 1 year, $62 million. And we're spending at all-time highs because we need staff, we're recruiting staff, we're using contract agency staff. You can't remain financially viable. You can't remain in business if you continue to spend at those levels. But your alternative, what was your alternative? We have residents, we have to care for them. They need and deserve 24-hour good care. We can't say, sorry, we can't deliver meals tonight. Sorry, you don't get a bath. You have to wait another. I mean, it just doesn't work that way. We pride ourselves on good care.
Well, I want to talk about that 62 million because the one thing in my time in the legislature that you taught me was the fact that, you know, this isn't the higher percentage of people are on Medicare Medicaid. And so Medicaid plays a huge role in making sure that our elderly are taken care of. And so if we're not able to take care of them, that's just money off the table. That's money that goes into North Dakota's business. It goes into Main Street, North Dakota. And so question number one, what percentage of the money coming in to help long-term care is federal? Number two, what happens if we're not able to utilize it? You mentioned $62 million. Is that just gone? Do we ever catch up on that?
Well, we're going to ask the legislature, the Senate Appropriations and House Appropriations, when they come in this week, to give us that some relief with that. 38 million for nursing facilities, because that's just a one-year loss. But regarding the percentage, 60% of all the dollars spent on long-term care come from Medicare or Medicaid, around 6-7% from Medicare, and then the remaining about 53% from Medicaid. So 60% comes from federal sources.
That's a lot. That's a lot. And with those federal sources, are there rules that apply that you have to adhere to? Staffing, quality of care, those type of things.
There are not specific staffing requirements. When I look at staffing, North Dakota's traditionally been the best staffed facilities in the country. So that data has been really good. And when we don't have sufficient staff, we'll reach out to contract staff. But each state regulates that a little bit different. But, staffing is critical to outcomes. If you don't have staff, you can't deliver care. So it does make a tremendous impact and a tremendous difference. North Dakota, as you know, too, has equalization of rates. So when we the rate for Medicare and Medicaid, it also is our private pay rate. So you can't say one day, you know what, we're just not making it. Our line of credit is gone. We need money. We have to increase the rates and give the notice. We can't do that in North Dakota. But, I have to say, historically, North Dakota, the legislature has always provided the money. We're in an unprecedented year, a pandemic that we have never before had this kind of spending, never before had these occupancy losses. We have never been in this situation before.
So let's talk about that, what the pandemic has done to long-term care in North Dakota. Give people an example of what some of these nursing care facilities have gone through.
Well, from day one of the pandemic, which was March 13th, can't even remember the specific date, of 2020, we instantly had, by federal mandate, needed to shut down visitation. You also then needed to screen everyone, all staff entering the building, anyone entering the building. You had to screen residents to make sure they weren't exhibiting symptoms. But most important during that period, what we found is half the people with COVID didn't even have any symptoms. So we were unknowingly spreading it from people that didn't even know they had it. So it was like this invisible enemy that was standing right beside you and you had no idea. Right now, today, we have all the mitigations policies in place that we had from day one. You screen, you temp, you don't allow anyone in that has any symptoms, you mask 24/7. What business is masking 24/7 today? And it's all in the measure, we need to keep people safe. We need to follow the federal regulations. It's been difficult. Today, even when I was looking at the data last night, we have 59 facilities that have a staff outbreak. And a definition of an outbreak is one case, because one case can turn into multiple cases. And we have 28 facilities that have residents that have COVID right now. In August, just 2 months ago, our numbers were we had 5 cases statewide. We were almost at 0. And now we're back with 123 residents, 157 staff. What happens when staff get COVID? They're out of work. They're out of work for a couple of weeks. Then we test everybody. We're doing testing now throughout North Dakota twice a week in facilities. I mean, I was talking with someone. The number how many tests they've had have been unbelievable. Can you imagine testing twice a week? Thank goodness they're not as intrusive tests as initially we started out with the nasal ones. But it still is difficult. So you're spending staff time testing everybody, getting them the results, then closing down wings if we have an outbreak, moving residents to COVID units that weren't in COVID units, notifying families, shutting down visitation. And it's almost, we were doing really good this summer. Our numbers were so low. And then this fall, as you saw, the Delta variant hit. It's the PTSD, the post-traumatic stress that we're seeing in staff thinking, oh my goodness, a year ago, these were the same things that were happening to us. The thing that's been the savior in all of this has been the vaccine. The deaths, we've had over 900 deaths. Those have been tremendously difficult. 900 residents dying in a short period of time. But when the vaccine came out, those numbers have dropped dramatically. And our residents are like 93% vaccinated. They want to live. They want to see their families. They want to get this over with. Staff right now, we're 71% vaccinated. We've had a nice rise this last week, and we have at least 38 facilities that on their own are mandating the vaccine with their staff, simply because to keep residents safe, to keep their staff safe, they believe that's their only option.
Well, Sanford did that. Sanford came in and so did CHI, and they said, you know what, you're going to get vaccinated or you're not going to work here. And of course, there was backlash. And in fact, I think CSI actually pulled back on the policy for at least a week, maybe longer. And then they went, no, we're still going to do this. And so when you talk about 71% of the staff out there being vaccinated, in your association, not many decisions are made without bouncing them by yourself and the board and others. Is there a consideration to saying just that? Because to me, it's a catch-22. You know, you've got 29% of the staff that isn't vaccinated, and you're way short on staff, and yet you know that probably the best thing you could do is to have everybody vaccinated. So you're in a box here, Shelly.
We debated that. We debated that this summer, saying what should we do? What is the most prudent thing? What is the best thing for everyone, considering the circumstances you just talked about? And what we arrived at, which was difficult, was we number one, support the vaccine. Absolutely, the vaccine has proven science, it's working. Number one, we support the vaccine. Number two, we support every business, every employer, every long-term care facility for themselves deciding what they need to do. So some have decided for a mandate, others have not. And so what we're saying is, who are we as a statewide organization to say, oh, you should do this, but support each business in the decision that they're making. And they're making tough decisions out there.
Yeah. If people want to find ways to help, or they want to get involved themselves, because some of them might be older than average workers, if people just want to help solve the problem you just described, what do they do?
You know what? Contact the long-term care facility in your community. Let them know that you're interested in working. We have part-time positions. We have flexibility in positions. Even if you physically don't have the strength, we have feeding assistants. So you could sit at a table with residents, help it cut up their meat, encourage them to eat, support them in cueing them that we're eating now. So there's so many different positions. Yes, the CNAs, those are labor intensive, but we have lots of positions. We especially need dietary staff, housekeeping staff, certified nurse assistants. So flexibility, you're making a difference, and contact your local facility. On our website, we have the list of all the facilities in the state. So you could even look at them and see, which one you might be interested in.
Shelly, what you do is so important. And I know there's a frustration level out there. Convey to them that all the people that watch Beck News want you to hang in there because, this is home for us. So thanks for coming on.